The biggest mistake doctors make when selecting admin support and how to avoid them. Hi, I'm Ben Dudley, Managing Director of Zento. Today we're addressing an important decision for any doctor in private practice, choosing the right solution for their medical billing and practice admin support. Whether you're a surgeon, physician or anaesthetist, making the wrong choice here can lead to missed revenue, patient dissatisfaction and a sense of time wasted. I want to share some tips and advice on what to watch out for when choosing a group or service to look after your practice administration. Note that I will not talk about employing someone directly to do this work. I will cover that topic in a different video. Balancing clinical work with administration and finding someone you trust. Running a private practice means managing a host of administrative tasks that keep the practice functioning. A private practice is, after all, a business. If you're in solo practice, you might find yourself juggling some of these non-medical tasks alongside your clinical responsibilities, which can become time-consuming and frustrating. On the flip side, joining a group or engaging a service to do these tasks for you might mean giving up some control over how your practice is managed and even branded. But above all, the biggest concern is, who do you trust to manage these important aspects of your practice so that you can focus on medicine? The risks of accumulating errors, misplaced trust, and lack of clarity. In a busy practice, it's easy for tasks to be missed and for small errors to turn into bigger problems. If you select the wrong group or service to handle your practice admin, the consequences can be even more damaging as you essentially have handed over control to them in good faith. Exploring your options. Finding the right support is essential. If you're considering joining a group, it's important to weigh the benefits against the potential drawbacks, like the risk of standardized protocols that may not align with your practice. On the other hand, outsourcing your administrative tasks to a service like Zento may allow you to retain more control over how you run your practice. The key is to find a partner who not only lightens your load, but is also trustworthy, reliable, and aligns with your practice values, needs, and goals. Do your due diligence and research. Ask your colleagues, read information and reviews online, and make sure you ask all the right questions to the representative for the group or service you are considering. Affiliations and conflicts of interest. An important point to consider is whether the group or service you are considering is affiliated with any third parties that you're not aware of. These affiliations could potentially cause a conflict of interest, especially if the priorities of your group or service are not fully aligned with yours. It's always a good idea to ask up front and make sure there's full transparency. You want to ensure that you're being treated as client number one. This means getting the attention and service quality that your practice deserves. If a group or service treats you like just another number, that's a red flag. These same risks apply in small groups of only 2 or 3 doctors, even with colleagues you know and trust. If things go sour or if there's a conflict of interest, let's say the secretary shows more loyalty to one doctor over the other, or if there's a pecking order among the doctors, this can create problems too. To avoid group dynamics and potential conflicts with colleagues, an independent, neutral billing and administration service like Zento could be a good option. Clear expectations and service agreements. Regardless of whether you engage a group or service to look after your practice administration, there needs to be clear expectations. What has the provider promised to do and how exactly will they do it? It's important to have these details in writing. Did you sign a service agreement with them? And if so, what does it look like? A solid service agreement should outline the scope of services, timelines, and performance metrics. This document is your safety net. It ensures that both parties know what to expect and can hold each other accountable. Even with a detailed service agreement in place, make sure you avoid what we call scope creep. This happens when a group, service, or individual is asked to, or at their own initiative has decided to, handle tasks beyond their expertise, leading to potential complications and frustration on both sides. It's important to set clear boundaries and ensure that your group or service is only handling the tasks they're qualified to manage. Finally, take a close look at the contract terms. Are you locked into a long-term agreement? What are the exit clauses? Flexibility is important. The needs of your practice might change and you don't want to be stuck in a contract that no longer serves you. Make sure you're comfortable with and understand the terms before you sign the dotted line. Choosing the right group or service to support your practice is a significant decision, and it's worth taking the time to get it right. By following these tips, checking their reputation, setting clear expectations, understanding their affiliations, and understanding their contract terms, you can make an informed choice that benefits your practice in the long run. And don't forget to subscribe to our channel for more tips on managing your practice administration and billing.